Ever think about how the temperature feels, especially late at night? We often just notice if we need an extra blanket. But what if those subtle shifts are linked to something much bigger? Today, we're diving deep into a really surprising connection: local nighttime temperatures and chronic obstructive pulmonary disease, COPD.
That's right. COPD is, well, it's this chronic lung condition. It causes breathing difficulties, progressive airflow problems, and it's a huge public health issue. Globally, it's the third leading cause of death.
Right.
We're talking over 3.3 million deaths every year.
Wow, third leading cause. And in the
The
U.S.?
U.S. alone, it's responsible for more than 150,000 deaths annually. That's roughly one death every 4
Well, every
minutes.
4 minutes. Okay, so our mission today is to unpack a recent study. It looked at U.S. county data from 2001 right through to 2020. And it zeroed in on this spatial link between COPD deaths and something called nighttime land surface temperatures, or LSTnt. We want to give you the key takeaways on this often overlooked connection. So let's start with the COPD side. Where are these mortality rates highest? The study found quite a bit of variation across the U.S. counties during those 2 decades.
A lot of variation, yeah. The average age-adjusted rate was about 73.9 deaths per 100,000 adults over 25. But the really striking thing wasn't just the average, it was how these deaths clustered geographically. They weren't random at all.
Clustered, so like hot spots.
Precisely. We saw these clear hotspots, especially in states like West Virginia and Kentucky. Really prominent there. And there was a demographic pattern, too. Males consistently had higher rates, around 90.9 per 100,000. So it's concentrated geographically and demographically.
Okay, so certain areas, certain groups more affected. Now let's bring in the temperature part, this LSTN, the nighttime land surface temperature. Why focus specifically on the night?
Good question. LSTN, which we get from satellites like Terra, gives us a really clear picture of ground-level warming in a specific area. And measuring at night is key because the readings are much less affected by direct sunlight or, say, heavy tree cover. It's a cleaner signal of the underlying surface heat.
Makes sense. And did the study see changes in these nighttime temperatures over the study period?
It did. There was a noticeable overall increase in the average annual LSTnt across the U.S. between 2001 and 2020. It went up from about 7.3 degrees Celsius to 8.4 degrees Celsius.
A full degree increase on average. Where was it warmest?
As you might guess, the high-end temperatures were really concentrated in the southern and southeastern U.S.
Okay, so we have COPD hotspots, and we have nighttime warming hotspots, particularly in the south and southeast. So what's the connection? This is the core finding, right?
Exactly. This is where it gets really interesting. The study found a significant positive spatial association. Basically, as nighttime temperatures LSTnq went up, COPD mortality rates also tended to be higher, especially in that eastern and southeastern part of the U.S.
So a direct link in those areas?
A very geographically specific link. They identified numerous counties in places like Texas, Oklahoma, Arkansas, Kentucky, West Virginia, Georgia. These were labeled high clusters, meaning they had both high LSTnt and high COPD mortality rates occurring together in the same place.
High clusters. And could they actually use this temperature data to predict the mortality rates?
They could, and quite effectively. The model they developed using LSTnt managed to explain about 68% of the relationship between temperature and COPD mortality.
68%. That's a strong predictor.
It's quite strong, yeah. It means LSTnt is a major factor. Their model predicted higher than average COPD mortality rates in nearly half, over 47% of U.S. counties.
That seems like a really valuable tool for public health folks, identifying where the risks are highest. But there was a wrinkle, wasn't there, about how the temperature changes mattered?
Yes, that was quite interesting. While the overall trend of rising LSTnt correlated strongly with mortality, rapid changes like a sudden spike or drop in nighttime temperature didn't show that same direct link.
Huh. So it's not necessarily the shock of a hot night, but more the sustained warmth over time.
That's what it suggests. It points towards a potential delayed or maybe chronic impact on people with COPD, rather than an immediate, acute reaction to short-term temperature swings. It implies we need to think about long-term environmental conditions, not just weather events.
Okay, so connecting this to the bigger picture then. The study acknowledges COPD is complex, right? Smoking, pollution, poverty, where you live, these all play a role.
Absolutely. COPD is multifactorial. LSTnt is clearly an important piece of the puzzle, but those other factors, smoking rates, air quality, socioeconomic status, how urbanized an area is, they can definitely make things worse in these high-risk, high-temperature areas. The warming might be acting like an amplifier.
An amplifier, so it piles on top of existing vulnerabilities. This really points towards needing solutions that tackle multiple things at once, doesn't it?
It really does. The findings underscore the need for integrated long-term public health strategies, thinking about things like, protecting existing forests, reforestation efforts, but also bringing nature into cities. Green roofs, urban gardens, things that can cool local areas, the urban heat island effect, and potentially improve air quality too.
And connecting those environmental actions with social support and healthcare access.
Exactly. Aligning environmental health with community health and well-being programs.
Okay, so let's try and wrap this up. We've seen this clear, geographically specific link, particularly in the east and southeast U.S., between rising nighttime temperatures and higher rates of death from COPD.
Yes, and it provides really powerful information for policymakers. It pinpoints areas needing intervention and highlights, quite starkly, that climate change isn't some abstract future problem. It has direct, measurable health consequences right now.
So, thinking about this deep dive, what does it mean for you listening? If these steady changes in nighttime warmth can impact lung health so significantly, does that change how you think about your local environment? And maybe how should the places we live, our towns and cities, be planned differently to protect vulnerable people as our climate continues to shift, making them not just cooler, perhaps, but fundamentally healthier? Something to think about.